Hi, my name is Dr. Janice Bothwell. I'm one of the consultant community paediatricians in Belfast Trust. My work is based in one of the community clinics outside the main hospital base. I see a variety of children who present with developmental issues, complex disability, epilepsy. So the type of children I see and their families can range from children who have really very little understanding of what is happening right through to very able children who are perhaps on the autism spectrum. And communication style has to vary between the children you see and the families who they are attending with. Communication for me is a vital part of my work. It's important in the assessment of the children, in being able to give information to families in a way that's easily understandable to them. And I find that one of the biggest areas of difficulty that we have in community paediatrics is when communication is done badly, and that's when families feel that they don't understand what's happening. The children are not able to contribute to their assessments, and as a result working relationships can break down between families and health professionals. If I have to think of cases where communication is really important in my role, as I've mentioned before, it is with the patients, but it's also with working with other professionals. I work very much in an MDT team, so we have child development clinics where we have allied health professionals and education professionals present. We have to be able to communicate effectively between ourselves, but also with our education colleagues to make sure that we get the best outcome for our children. Being part of a good team and being able to communicate for me means that I listen to other people's opinions, that the communication works, that people feel safe and happy to voice their opinions in an environment where their opinions are valued. I think that as a team we work together for the best outcome for children, and when the team communicates well, the outcome for the children is good. Where teams do not communicate, there are problems. So if I have to give advice to junior trainees on how to communicate effectively, I suppose my helpful hints would be, first of all, think about what you're trying to communicate. So it may be that you are trying to explain a diagnosis, or it may be that you're trying to explain what what should happen next. Make sure that you know what the parents or the child understands. Always ask, clarify. And then when you've given information or when you've had a discussion, make sure that you can check back with the parents and the child that they fully understand what you've talked about. If you do all of those things, then hopefully you'll have had a good consult with them, and good luck. Thank you.